We welcome you back to the program. How many times do we hear somebody say, oh, my aching back? Well, we have two guests on the program today who are experts in dealing with aching backs and all kinds of conditions with the spine. Joining us today from spinal pain specialist, Dr. Gerayli. Welcome back to you, sir. Good to have you with us.
Thanks, Rob.
And Dr. Bajaj, back with us as well. Good to have you on the program today.
Thank you.
So let's talk a little bit about arthritis, specifically how it impacts the spine. I guess let's start off, definition of arthritis.
You know, Rob, arthritis is basically defined as inflammation of joints. The word itis is Latin for inflammation. So anytime you have any kind of an inflammation in any of your joints, it can be classified as arthritis. However, there are different categories. You have rheumatoid arthritis, which is typically an autoimmune type of illness where your body attacks the joint tissue. You have osteoarthritis, which is the typical wear and tear that typically affects the large weight-bearing joints. And you have degenerative arthritis, which is, again, wear and tear, and that typically affects small joints that are, especially in the spine, that are weight-bearing. Mm-hmm. So there are different types, but in the spine itself, there are several areas where arthritic conditions can cause chronic low back pain, and it may not necessarily have anything to do with the discs. Mm-hmm. Dr. Bajaj treats quite a bit of arthritic conditions in the spine in our practice, and he has come with us today to share with us some of those treatments.
Well, let's talk about that. First of all, I think maybe causes. You know, sometimes people will say, well, the weather affects the way my joints feel. Maybe not so much the spine, but maybe our extremities, if it's too cold or whatever. But let's talk about what are some of the causes that you find specifically in the spine area with arthritis?
Well, ultimately with arthritis, the problem is a loss of the cartilage. Cartilage basically acts as a lubricant as well as a shock absorber for all intents and purposes. When that begins to wear down with degeneration, you get more bone-on-bone contact. And when that occurs, you can get inflammation of that joint. Mm-hmm. Now, in the spine and in the low back itself, there are two principal areas where this is very significant. One is in a joint called the sacroiliac joint, which is located just below the belt line. And that is responsible for maintaining your posture as well as maintaining the weight bearing of your thorax.
Mm-hmm. We've all seen pictures, and sometimes you've even brought us some models of a spine, and it looks to me like the bones get smaller as they get close to the end, the coccyx bone. The fact that those are getting smaller, is that having any impact? Does that have an effect on the fact that they're because it causes pain?
That's a good question, and not necessarily, but that is exactly where the sacroiliac joint is located. The sacroiliac joint is the largest joint in the body. Mm-hmm. Now, because arthritis is an inflammatory state, the goal is to deliver an anti-inflammatory as close to that joint as possible.
Right. What about age? Should we just all expect this as we get older? We're all going to have back pain?
Well, you know, there's several components that can exacerbate arthritis. Degeneration is definitely one, and that does come with age. There's no doubt about that. There is also a genetic factor as well, which can play into it.
Pick your parents carefully, as they always say. All right, well, treatment. You gentlemen are specialists in the spine and dealing with pain in the spine. Obviously, depending on what the cause is, would determine the treatment process, and the degree of discomfort, I guess, would determine what you do as well. But give us some typical ideas what you might do if somebody comes in with arthritic back pain.
Sure. So let's take the previous example that I was mentioning. If the SI joint is the source of the problem here, causing the predominant pain in a patient, then what we can do is deliver an anti-inflammatory to the joint itself. Mm-hmm. Now, there's several ways to do that. One is by taking medications by mouth, but that's not very potent, unfortunately, and there are several side effects. Really, the next step up would be to deliver the steroid medication, which is the strongest anti-inflammatory known, directly into the joint itself.
So that would be an injection into the spinal area?
Well, into the joint that's being affected.
The joint itself, yeah. Obviously, you know, you're hitting an area that's probably not all that big, right? I mean, how do you know exactly where that is? Do you look at x-rays?
Well, that's a good question.
Or do you feel along the spine and there it is?
Well, what we do, we actually have a fluoroscope, which is a live x-ray machine. And this allows us to literally visualize the joint under direct visualization in real time. So we can be absolutely certain that we are in the appropriate area before injecting any medication whatsoever.
Good, that's great. So that would be the next step along the line. Hopefully that would bring the relief to the person. If not, potentially, what, some type of surgery possibly, or other treatment along the line?
Well, surgery is also an option, but prior to reaching surgery, technology allows us to do what's called a radiofrequency ablation of these small joints in the spine. And what that means is that you can denervate the joint so that the joint has no sensation anymore. They're very small nerve endings that supply the joints and provide only sensation. They have no other function. So
Uh-huh.
it's very easy to identify them.
Right.
And using radiofrequency technology, zap the joints and using heat, denervate the joint so that the joint doesn't have any sensation.
Right.
Once it doesn't have any sensation, the painful
The arthritis
problem
continues
goes.
to be there, but you don't feel it as much. The
That
pain
is
goes
correct.
away. So you start off with oral medication. If that didn't work, the injection, followed by this procedure, and then as a last resort. But that would be a definite way down the line before you'd want to do really surgery on someone like this. I think.
Correct.
What about therapies type of things? Stretching exercises, weight-bearing exercises. Can that relieve some of these problems?
Well, absolutely. Weight-bearing activities can definitely make arthritis much, much worse. It can significantly exacerbate the pre-existing condition. So non-weight-bearing activities such as swimming, a stationary bicycle, and sometimes an elliptical trainer can also help. Other lifestyle factors can also be very significant here. For example, obesity increases the overall weight bearing of any joint in your body. So if obesity is a concern, that's something to be
Smart on
addressed.
them as well. Yeah.
Exactly.
Good. All right. So prevention. Obviously, weight control is one prevention way. Other ways we can prevent this?
You can't really, prevent the ongoing wear and tear of the joint. However, you can really reduce the extent with which that degeneration progresses. So when you talk about exercise, strengthening exercises to strengthen the muscles around these joints can also help unload the joints so that you don't rely on the joint itself, but use the muscles around the joint to unload the joint and take some of the weight off.
We always hear that all of us should get some exercise, but it sounds like the right kind of exercise.
Precisely.
Appropriate exercise. So what works for 55 plus may not be what 25-year-olds are doing at the gym, but people need to do what's best for them and best for their health and for long term and longevity and pain reduction as well.
And make sure that in the process you don't sustain other injuries.
Right,
So
right.
it has to be pretty tailored.
What do they call them? Gym rats, people that are there twice a day, 7 days a week, and working out really hard, but might do some damage and cause more problems along the line there as well.
That's correct.
That's great. Well, it sounds like you've got some great techniques available and some great ways to deal with these problems. Final question, is weather a factor? Can people predict weather by their arthritis or by their pain? Do you think it's possible?
I'm not sure if people can predict what the weather is going to do. However, there's anecdotal evidence that symptoms can change with changes in barometric pressure, humidity, and so forth. So even though there hasn't been any specific scientific research on this, there's plenty of anecdotal evidence that patients who have arthritic conditions do better under certain conditions and in certain environments, and that's why people move from various cities across the country just to help their condition.
I guess that's why Mr. Del Webb built all his Sun Cities where he built them.
That's right.
In the warmest areas and driest areas you could find. Although some people really need the moist heat for certain kind of conditions as well, so it kind of depends on what your conditions might be, and your pocketbook if you can afford to move to these places as well.
That's right.
Anyway, we thank you both for joining us today. If you folks have any issues or questions about your spine, there's the number on the screen. You can give them a call, 855-7560, and facilities right here in the area, and your staff stands by to help folks out at whatever level of discomfort they may have.
Absolutely.
Great. Thank you both for joining us today. Spinal Pain Specialist Medical Group. We thank the doctors for joining us today. And again, check with them if you want more information on your specific medical needs. We'll be back with more as our Friday program continues for you right here on Channel 6.